Hi guys, Birmingham Immersion course here today. Just thought I'd do a really quick video on blockers and what happens in medical role plays and how they can make your life difficult and how you can challenge them with three things: recognition, expansion, and negotiation. What is a blocker? A blocker is something that tends to come in an acute case. So something where you're trying to admit a patient, for example, or an urgent referral type of case, something where there's a bit of urgency where you think something needs to happen. What is a blocker? It's something that potentially gets in the way. So something that's coming up in the patient's life or the role player's life that potentially puts a spanner in the works. It stops you being able to do the urgent referral of the admission that you want. For example, a wedding that's coming up in a week's time, or an exam that's coming up in a week's time, or they've got a really important work meeting. So things that potentially can get in the way of you doing something urgent. 3 steps are very important when it comes to blockers in role players because I see people struggle with them a lot in role play scenarios. Number 1, recognition. You've got to recognize the cues early on that something is going to potentially block your route later on. So in data gathering, in the first half, you're doing a history and something pops up a few times. A work meeting is mentioned a couple of times, or a holiday is mentioned coming up in a week's time, or something like a wedding is coming up in the family. You've got to recognize that as a potential blocker. That's not just thrown in there randomly. That's something that maybe is going to come back later. So if you don't recognize it, then you're going to struggle when it comes out again in the second half. So the first thing is recognition. The second thing at that point in data gathering is expansion. If you recognize a potential blocker, do the hard work now and ask the few extra questions that are going to help you in the second half. So if it, for example, is an exam that's coming up, find out about that exam. When is the exam? How many exams is it? Is it just 1 or is it 2 or 3? How long does it go on for if it's an exam period? What is the exam? How big is this in your life? Have you let college know about what's going on with you and your health at the moment? These kind of things are so important so that you can come back to them later and discuss and potentially negotiate those blockers. If it's someone mentions a work trip coming up, ask about that. What's the nature of it? How important is it? When are you traveling? Who are you traveling with? Have you got travel insurance? Remember that work thing is going to probably come back later when you may talk about admitting a patient. How can I go to hospital, doctor? I've got that work thing that I mentioned, remember. So expansion in the first half is very important. If there's a wedding coming up, whose wedding is it? When is it? Where is it? Again, get those little details in now. They're going to save you a lot of time later on when it comes around to step 3, which is negotiation. Now, if you've done a data gathering, you think someone needs to go to hospital or someone needs an urgent referral, you may want to do that in the second half. That may be your plan, but this is where blockers will come out. So you may wish to do something, but the blockers will, but what about my exam doctor? Or what about the holiday doctor? Or what about my meeting doctor? This is where negotiation takes place. If you don't negotiate your way around that blocker, you may not get the patient to agree to do what you think they need clinically because this thing is so big in their life right now. So you've got to negotiate, and this may take a little bit of time. It may take a bit of thinking outside the box. You may need to bring back the details that you worked out in expansion. If you know about people in their life, if you know about who else can you approach, who else can you bring into that situation? Can I write a letter to work? Can I write a letter to travel insurance? You've got to negotiate your way around the blocker, because if you don't often do this, then you may not get to the point where they've agreed to do the clinical thing that you think is really important, like the admission or the urgent scenario. So blockers are really common areas that can delay medical role plays. They can add a lot of time because you're trying to do something clinically, but the patient's not quite with you. So you've got to recognize it early so you're ahead of the game. You've then got to do the work and expand on it to understand that situation before it hits you later. And then you've got to negotiate your way around that blocker before potentially the patient in the role play agrees to do what you think they need to do clinically. And of course, there are other things that we talk about with admission cases and acute cases, like ultimate risk, for example, but blockers are a really important thing to think about when it comes to medical role play exams. Much more like this on our immersion courses, CSA, GP Stage 3, and PLAB 2. Hope this helped. #CampPassWillPass, #I went with Arora.